Setting your good standards are essential for a glaucoma practice. There are various subjective and also objective methods. This topic focuses on the importance of fundus photography. I don't have any financial disclosures. The optic nerve head examination can be done both clinically as well as by different imaging methods. A detailed optic nerve head drawing in clinical practice helps the clinician to treat the patient properly as well as it helps in the follow-up of the patient. We will see what are the differences between the slit lamp examination on the optic nerve head versus the fundus photography. There are various instruments and equipments are available to take the fundus photography. That includes the SLO based, that is scanning laser ophthalmoscopy based equipments, and the non-scanning laser ophthalmoscopy exam methods. It can be mydriatic cameras or it can be non-mydriatic cameras. It can be attached to our slit lamp or it can be a portable device. When you do the optic nerve head examination in glaucoma, there are various checklists one has to go through. The slit lamp coverage is a vertical slit which covers a small portion with the dilatation or without dilatation. But the area which is covered is a very small portion. You can use the magnification to see the details of the disc and the peripapillary area. The next area seen is the blood vessels and also the macula. But the magnification and the width and the examination is very limited. When you use the fundus camera, you can see the difference between the fundus camera and the clinical disc evaluation. The coverage in the fundus camera is starting from about 30 degrees to 200 degrees depending upon the type of camera which is being used. You can use this fundus camera, the fundus photography. You can see that there is a easy simultaneous comparison. So in one shot, you can look at the optic nerve head of both eyes to see what is the size, shape, cupping, RNFL changes, and any other disease is involved in that eyes. The true color image versus the red-free comparison helps us to identify how much of the RNFL damage is occurring or already there. It helps us to use this magnification so that every nerve fiber layer can be easily seen for the damages. Also, you can see one more picture on this. The RNFL changes are significantly picked up by increasing the magnification. The disc hemorrhages of various types. Also, on the follow-up, you can see when the disc hemorrhage is absorbing, it is leaving a RNFL damage. The peripapillary area is very easy to see in the fundus photography than by any clinical drawing method. RNFL defects can be very well documented by fundus photography than using the clinical drawing. The progression in the fundus photography also can be easily documented. You can see in this picture there is a disc hemorrhage which is disappeared on the follow-up, but it is leaving out the RNFL change which is seen very evident. Also, by using the editing tools, one can see the size of the disc and also the size of the cup, and also it can use the RGB filters. This is one of our publications in the Indian Journal of Ophthalmology where we have shown the usage of fundus photography in the artificial intelligence. Practice flow and the comfort. By taking the fundus photography, using the LAN connection, one can see the patient's fundus photography in their desktop, which really helps in understanding about the glaucoma of the patient. Is it the fundus photography takes a lot of time? It is not true. So it really helps the physician to take the fundus photography in a very quick time, and there is no difference in the waiting time. So we can change the practice pattern to help our patient. So we can make a change today. Thank you so much. Hope this topic has helped you in your practice. Thank you.